Hey everyone, it's Adrienne and I'm back with another video. This is a nursing school story time. So during my nursing rotation, my clinicals for our ICU clinicals, I had a patient who was a younger patient. She was probably like 26, 27, somewhere in that age range, and she about my age. And she had been intubated, and it was time for her to get extubated. So the doctor was in the room with me and my nursing instructor, Miss Roberta. Love that lady. And he told me, because it was a teaching moment for me, he said, if this patient starts making this sound, and he did the sound, he's like, make sure you get someone right away because it could be an emergency. And I was like, okay, fine. So once everybody left out, I started helping the young lady get cleaned up, and we were talking, and and everything seemed great. And then all of a sudden, her eyes kind of got big, and she seemed like she was having difficulty breathing. And then she started making this sound, and the sound was the sound that the doctor told me to make sure that I came and got someone right away if she started doing it. So I go out in those little glass cubicles in the ICU, like outside that door, and there's a table in ours, and usually there's a bunch of folks out there. There's nurses out there, there's doctors out there, therapists, different people. But of course, when Adrienne needed somebody, there was no one out there. So I'm running around like, oh my God, where's my nursing instructor? Where's my nursing, Miss Roberta? I need you. I need you. And then another nurse happened to be passing by, and I was like, oh, can you come in room 7? I guess it was 7. I don't know. I said, can you please help me? Can you please help me? Because the doctor told me that this patient that just got extubated, if she makes this sound, that I need to get someone right away. So the nurse went in, and then she came running back out, and she, called a code, and everybody came in, and they started working with the girl. And of course, the sound that she was making were striders. And I was just like, oh my gosh. Well, she got re-intubated, and I guess she was okay because that was our only day there in the ICU. I'm pray she, everything worked out for her. But for me, it was very traumatic because I was like, oh my gosh, Miss Roberta almost killed the girl, almost killed her. She's like, Adrienne, calm down, calm down. You didn't almost kill her. That is just something that happens when, once some patients get extubated, and, it was nothing that you did. I was like, oh no, no, no. I'm like, crying, and I'm like, oh no, no, I'm never coming back. I'm never coming back. I can't do this. It's too stressful. I'm going to quit nursing school. Oh, I can't. And she's like, Adrienne, calm down. You can do this. She's like, you got this. You can do it, and it's fine, and you didn't do anything wrong, and it'll be okay. And I guess it was okay because here we are 30 years later with me almost about to retire, and I made it. So, was there a situation while you were in nursing school, or even as a young graduate nurse, that made you think you wanted to quit nursing, but you didn't because you actually had it, just like Miss Roberta said? It was fine, and I had it. So, comment down below and let me know if you have a momentous occasion that may have caused you to almost quit nursing school or almost quit nursing. Talk to you later. Bye.